Hey everybody, it's Matt Shu at Upright Health, and I'm here today with my buddy Josh Hash.
Sorry, guys.
And in this series of videos, we're going to be talking about muscle balance. And specifically, we're going to talk about whether or not muscle balance matters. You think it matters?
I think so, a little bit.
Just a little bit? Yeah.
Yeah.
At least a little bit. The reason we're talking about this is because there's been a move in the last several years to look at chronic pain as an issue of central nervous system dysfunction. And so in its most simplified form, the idea is you have some ache or pain, there's no obvious problem, there's nothing ripped, torn, nothing broken, but you have this pain that keeps going on and on and on. You try PT, you try doing different exercises, you do all these things, and it doesn't make any difference to your pain. Since you did these exercises, since you did massage and chiropractic and whatever else you did, and it didn't help the pain, then your pain is a sign that your central nervous system, your brain, all your nerves, something is going wrong, right? So basically, the idea is the pain signal itself is incorrect, and you need to somehow try to stop the pain signal. There have been studies done that try to show that even if you do different kinds of physical therapy protocols, that they don't work, that when you do these things to try to address muscle balance, they don't work to correct the pain problem. So the assumption then, the conclusion then is, oh, well, muscle balance itself just doesn't matter since we do it and it doesn't seem to help. But there's some problems with that conclusion, and we wanted to go step by step through some of the assumptions that are involved in coming to that conclusion. So again, the overall theory is that pain doesn't go away, then that means that pain doesn't go away from doing exercises, then that means the muscle balance doesn't matter and it's a central nervous system issue. But what's the first major problem with that, Josh?
Well, the first major problem is that we are assuming that we have all these 4 different variables that we're going to discuss right now, that we have these correct. And, as you'll see, these may be easy to not have correct. Okay. Right. So the first one that we want to talk about is we're assuming that you're doing the right exercises and that you are targeting the right muscles or muscle groups. Mm-hmm. Mm-hmm. So, that in itself can lead to, confusion, right? Because we don't always know which muscle needs to be targeted, mm-hmm. which exercises are going to target that muscle correctly, mm-hmm. right? Mm-hmm.
So I think one example that you and I have discussed before is with back pain. Your back pain can be caused by multiple issues, right? So if you have somebody who has back pain and they look like this, and you say, well, you have a weak core, if you tell me do more sit-ups, this might actually make my back pain worse, right? Mm-hmm. If I'm doing exercises that are hitting the wrong muscles, or if I'm just doing straight, completely wrong exercises, I can make my situation worse, right? So
lead to greater imbalance rather than more balance.
Right, and that's gonna hurt me. But if we're not paying attention to how we're choosing the exercises, that's going to cause a big problem. So that can happen with hips, that can happen with shoulders. If you're choosing the wrong exercises, if the protocol that's being studied in a research study is actually doing the wrong thing to people or doing the wrong thing to a large majority of the people, then it may look like muscle balance doesn't matter because you're seeing so many failures. But the reality is you're actually ending up with more pain because you've actually set the muscle balance in the wrong direction.
Right. And this is going to happen a lot in kind of like a one-size-fits-all approach, right?
Yeah. Yep. One size does not fit all.
Yeah. So the second assumption that we're making is that you are executing the exercises properly. So basically, form. Do you have good form? Are you doing these exercises correctly, right?
Right, yeah. And so that's something that we've seen a lot with people with hip issues. Maybe they go and they are told they need to do some glute activation exercises, but then the way they were coached to do it makes it really difficult to feel the correct muscles working. And a lot of people can't feel the right muscles working unless they are coached very specifically to pay attention to it, or maybe regress to do an easier exercise to make sure that the right muscle is being activated. So execution is a huge deal and it can go wrong really, really easily.
Very easily, yeah. We deal with it all the time. So the third assumption that we're going to make is that we've done this for the appropriate time frame. So how long have you been doing these exercises with proper form to expect to get results from them?
Right. So it's like if I want to be able to lift 200 pounds, if I expect to do that in 1 week's time and I've never lifted any weight before, it's not surprising if I miss my goal, right?
Yeah, exactly. And I think this happens a lot of the time with whatever physical therapy, chiropractic, whatever. You get your exercises and you go home and assuming that they are the correct exercises and you're doing them with correct form, you do them for a week and maybe you're just not seeing the progress that you want to see and you stop. Well, that probably wasn't the appropriate time frame that you needed to be doing those exercises. So, that's a very easy one to get incorrect, especially when you're on your own and you're not working personally with a coach or trainer or somebody.
I think one thing that plays into that for a lot of people, this will probably resonate with a lot of people who have been through physical therapy, is you're doing exercises, you think you're doing them right, and they're still not helping. So in that case, it gets very demoralizing to continue to even do it for the right time frame, right? Because it's the wrong exercises, so you're not even feeling things improve. But assuming, like you said, you're doing the right exercises and you're doing them correctly, then you do need to make sure you're doing it for the right amount of time. Otherwise, you're not going to see the endurance increases. You're not going to see the changes in the way those muscles move, in the ease with which you can recruit the right muscles. That takes time. So
we see it in here all the time. Like some people are so imbalanced that it literally takes months before we can kick on the right muscles to start to even out the body, right?
Right. So final thing that often goes wrong is intensity levels. So this happens a lot with people who are in pain. They'll just be told, hey, don't do anything heavy.
Yeah.
Right? So your shoulder hurts, never touch anything heavy, never lift it up, never try to hold anything heavy, just go easy. Same thing with hips, like, oh, your hips hurt, your knees hurt, whatever. Don't do anything that's strenuous, right? Never squat, never try to do a lunge, never try to lift anything heavy. Stay away from anything that might challenge your body too much. And does that work?
Yeah, no, that doesn't. You can make so much progress doing that, but eventually you need more intensity to challenge the body to adapt and to grow stronger, right?
Yeah.
So you can do all the glute kickbacks that you can do, but eventually you need to load it with maybe some type of weighted bridge or something like that to increase the strength of your glutes, right?
Yeah. So one of the examples I like to give clients is, if you expect to be able to jump higher, you can't follow a strategy in which you never jump. If you want to be able to reach something that's on a high shelf or in the cabinet, your shoulder's never going to develop that ability if you're never challenging it to go anywhere near that. So a lot of times people are told, like, oh, if it hurts, just stop using it, or just do things really light. Sometimes you actually need to use enough resistance to train the muscles to be able to stabilize enough to help you do that harder thing, to help your body feel comfortable on a regular basis. Just easing off all the time doesn't always work.
Yeah, right. Sometimes adding some load can actually help your body just kind of coordinate and do what it needs to do, right?
Assuming we have the right exercises, the right execution, the right time frame.
Yes.
Right. So it's got to be the right exercise. Number one, it has to be the right exercise and the right muscles.
Yeah. And along with intensity, I think we could also throw in just overall volume, right? Like are you only doing your exercises once a week? Like, right? Frequency plays a big part in things, and then just total volume of maybe you started doing 2 sets of 10, but you've been doing that now for 2 weeks, 3 weeks. Now we could probably do 3 sets of 10.
Put some weight on you.
Right. So a lot to take in consideration there, I guess.
Right. So we have these 4 major things. We've got the right exercises, the right execution, the time frame, and then the intensity. So there's a lot of ways these things can be toyed with. You can adjust these things, and there's a lot of room, because it's so complex, for things to go wrong.
Yeah.
There's a lot of things that can just be flat out the wrong choice that can really sabotage your progress. So the question then is just thinking about these 2 options. One option being muscle balance matters, and we're just messing up some of the variables, or muscle balance doesn't matter at all, and your internal system is broken. Right? When you think about it and think about which one is more likely, it seems like it's extremely improbable that so many people with chronic pain are having their brains and their nervous systems break randomly and just stop functioning correctly. It seems much more likely that, given how many things you can choose and do wrong, how many pieces of that puzzle there are, it seems much more likely that you can end up with the wrong variables that just give you the wrong result. So if you can then go and fix, number 1, the exercise choices, and then number 2, the execution, and then make sure you keep the time frame intensity right, you can make a much bigger difference to how comfortable your body feels. But that requires a bit of a perspective shift away from anatomical problems and more towards, instead of looking at x-rays and MRIs, it's more towards functional motions and making sure the right muscles are kicking in, right?
Yeah, totally. And it takes some trial and error, which, that second option of just saying that your brain's broken can be the easier option to choose, right? Because that's you can just settle for that. But if you really know that muscle balance does matter, then it's going to take some energy. You're going to have to figure out, yes, I need to figure out which exercises work the best for me to achieve this function, right?
Yeah. That's challenging, but that's super, super important.
Yeah.
So we wanted to present those ideas to you, make sure it's clear. You understand that there's a lot of complexity to choosing the right exercises, to getting the muscle balance back in your body, and that's what you can focus on to really proactively help your body feel good. So we hope that clarifies things for you guys. We're going to follow up this video with a couple videos to show you examples of how this looks in practice, with real examples of how people end up getting frustrated because of some of these variables going wrong. So make sure you check out the next video, and remember that pain sucks.
Life shouldn't.
If you liked the video, don't forget to like, share, and comment. And don't forget to subscribe.